This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss at-home ketamine therapy using home-based ketamine nasal spray. Now, we know that IV ketamine can produce more rapid remission and responses in treatment-resistant depression than any other formulation of ketamine. There's numerous studies demonstrating that, and clinical work as well demonstrates the same. However, a number of individuals prefer to use at-home ketamine therapies simply because it has a number of different benefits that the IV formulations do not have. So is at-home therapy right for me? Well, what are the benefits and the risks? Well, the benefits are clearly convenience. It's obviously a lot more convenient when you can use your ketamine treatments at home. And certainly the expense can be a lot less than getting IV infusions of ketamine. Of course, there's less time spent getting to the doctor's office, and of course the cost of the infusion, and a number of other factors, including getting a ride back home. Now, certainly the at-home therapies can provide relief for mood disorders such as depression, anxiety, and painful conditions, but frequently it's just relief, so you're less likely going to get remission with at-home ketamine therapies. So a lot of people kind of use the home-based ketamine as kind of a pick-me-up. But effectively, ketamine therapies used in the home front are better served as maintenance tools after IV ketamine infusions. So at Nova Health Recovery, we generally place patients on at-home ketamine therapies using intranasal ketamine and also oral ketamine combinations, and we titrate those to effect as a maintenance tool in between the booster infusions of ketamine that individuals may need for whatever condition they're seeing us for, whether it's mood-related or whether it's pain management. Now, the risks of at-home therapy are that if the ketamine therapy works, it certainly may take a while for you to see its effect, and it's less likely to produce remission. The other thing is that ketamine burns when it's administered intranasally. And some people complain of nausea, dizziness, and abdominal cramps, as well as the bad taste. And this is a treatment, not a cure. So it requires ongoing treatment frequently. It requires an ongoing care plan and also management. Now, there's also an abuse and misuse potential. Now, we know that ketamine is extremely safe and that there is no physiological withdrawal for the most part, so individuals can use ketamine and stop it, and there's no withdrawal effect. But certainly individuals can use this in the wrong context and also use it at the wrong time. This is, of course, monitored by prescription, so there's a number of monitoring tools that we administer to basically make certain that patients are compliant with the care plan. Now, the benefits of nasal spray ketamine over oral ketamine are several. And nasal ketamine is absorbed more rapidly at a higher rate. So approximately 50% of the nasal spray of ketamine is absorbed, whereas the IV formulation is 100% bioavailable, and it's instantaneous. Oral ketamine, on the other hand, there's about 20% bioavailable. And the way that oral ketamine is generally taken is it would be preferred to use a sublingual route, and you basically place the oral tablet or troche under your tongue, let it dissolve, and you get the first wave of absorption. And then you would swallow the rest of it to get your second journey effectively. Now, some people will spit out the oral ketamine, but that said, if you swallow it, you'll end up getting, again, a secondary effect that's a little bit more prolonged. Now, IV ketamine is certainly the most precise in administration, so the moment the IV drip is turned off, within a few minutes you're back to your baseline. And the other issue about intranasal ketamine that kind of beats the oral ketamine is that it's titrated more easily and more rapidly. So you get a spray and you pretty much get your results within a few seconds to a few moments. Now, there's also a smaller distance across your nasal passages when you spray the ketamine nasal spray in that area. Your olfactory nerves are up in the upper nose area there, and also the distance across the nasal passages is very thin, so you're right literally next to the brain. The at-home ketamine, whether it's nasal or oral, is racemic ketamine. It's R and S ketamine, and it's a 50-50 mixture. So I just want to make that point that you're getting both right and left-handed forms of ketamine. You may know that S-ketamine is the FDA-approved version of nasal spray ketamine. It's given in the office, and we'll discuss that shortly. This is, when you get it compounded, a 50-50 mixture. Now, oral ketamine really relies on sublingual absorption and gut absorption, and it's a lot lower absorbed relative to nasal spray ketamine. The other thing is that once you take oral ketamine, you really can't stop the journey. So you're going to basically get the absorption under the tongue or when you swallow it over a period of time. And so if you don't have the dose right, you're certainly going to have some dissociative or trippiness effect. Now, you can use oral and nasal spray ketamine together, and we frequently do a combination simply because some people find one version to seem to be more effective than the other, or sometimes the combination seems to give some sort of additive effect. Now, the consistency of the psychedelic effects can be profoundly different with the oral formulation relative to the nasal spray, but each person's experience is different. And so some prefer the nasal spray because of its speed with which it actually causes its effect, and others prefer the oral version simply because they seem to get better long-term results. Now, just remember, you're not looking for dissociation or the trippiness as being the actual effectiveness of this medication, but rather the neuroplasticity that follows. So it's not the trippy part that you should be focused on. It's not the reward of the journey, but rather the end result of neuroplasticity and longer mood improvement. Now, the other issue with oral ketamine tablets is that they can have asymmetrically distributed ketamine present. So as they're made in the pharmacy, sometimes the ketamine's not evenly distributed. So again, that's another issue as well. So sometimes the oral tablets will absorb well one time, and the next time you just don't seem like you've got as great an effect. Now, the other point is that some centers will offer extremely high doses of oral ketamine to the tune of several hundred milligrams per dosing. And the issue with that is that sometimes absorption can be pretty intense, and those individuals can dissociate quite extensively. For a person who's just getting started in this treatment, such high doses could be quite scary. So working with a provider directly and titrating the dose to the longer effect of mood as opposed to the shorter effect of the trip is actually the way that this would work best. So just as a quick review, there's two formulations of ketamine. There's a right-sided and a left-sided form of ketamine, and basically each of them interacts with the body in different fashions. When you receive ketamine in the office, it's a 50-50 mixture of R and S ketamine. The same thing with the oral and home-based intranasal ketamine. Now, S-ketamine, which is the FDA-approved version, is basically 100% S-ketamine, and that's administered in the office only. But effectively, you're looking at mirror images of ketamine, so a right-handed and a left-handed form. Now, nasal spray ketamine is, as we mentioned, a racemic mixture of 50-50 of right and left-handed ketamine. It's made in compounding pharmacies only. And generally, the compounding pharmacies will use a preservative such as methylparabene and propylparabene to kind of preserve the ketamine itself. And this can certainly produce burning on administration. Now, this type of formulation does not need to be refrigerated generally. It's for home use only, and driving after using it is not allowed for at least 4 hours, if not longer for some people. And it can be produced in really any concentration, but generally 10 and 15% are kind of a standard formulation, meaning for 10%, you're getting 10 milligrams per 0.1 ml or 100 milligrams per cc. So generally speaking, a single spray releases 0.1 ml. And so if an individual sprays 10 sprays in their nostril total, they're getting basically 100 milligrams. Now, 15% solution has effectively 15 milligrams per spray if each spray is 0.1 ml. Now, the problem with higher percentages of ketamine is that it starts to precipitate in the bottle. So doses or percentages above 15% begin to precipitate quickly, and so most pharmacies will only produce the 10 or 15% dosing. Now, for microdosing strategies, just remember that when you're using the home-based ketamine, you're not really supposed to feel anything. Microdosing refers to basically dosing such that there's no palpable, perceptible feeling or changes, but yet the longer outcome of just improved mood. So, an example of initial dosing strategies for like depression maintenance, if somebody were to do, let's say, IV infusions and got good results, we might say, okay, well, based on size and weight, and this is just a example, somebody might use 2 to 4 sprays of a 10% solution in each nostril 3 to 4 times per week. And then that dose can be titrated according to the person's outcome and effect. But that requires frequent report backs, self-reporting, and journaling on the side of the patient. And of course, the physician has to have an active role in determining these dosing strategies. Now, the dose again is titrated according to outcomes of mood as measured by validated scoring systems and self-report as well as functionality. It's not based on whether the person felt it or whether they felt trippiness or dissociation. So sometimes when patients are using ketamine therapies at home, they'll be like, well, I just don't think it's working anymore because I don't feel anything. But yet their mood is better, they're functioning at work in the home environment. It's just that they don't have the perceptual changes that they get with the ketamine itself as it's administered. And there's nothing wrong with that. So when does ketamine start to work? Well, with infusions, we know pretty quickly when they're working. Generally by the third or fourth infusion, most people are seeing effectiveness, and it's extremely rapid within days, sometimes after that first infusion. But with at-home nasal ketamine, the significant results might take a few weeks to actually show up. And even though some people get relief within a few days, again, you may have to wait a few weeks ultimately for the peak effects of nasal ketamine to work. Now, ketamine therapy can certainly augment the response to traditional antidepressants. So really, ketamine therapy can be started even at the very early stages of depression or mood disorders. So you don't have to be treatment resistant to start this therapy. And results are not as robust when you use home-based or at-home nasal spray ketamine first relative to intravenous administration of ketamine. IV ketamine puts 100% bioavailable ketamine into your system, and it has more effective and robust and rapid results than home-based or at-home therapies. Now, you definitely will need to have dose escalations and titrations of your home-based ketamine over time to produce the appropriate mental health outcomes. And this is because a smaller amount of the nasal spray ketamine is absorbed than the IV formulation. And it appears that a certain blood level of ketamine may be more effective at producing mental health response. So it's really hard to say how much your nasal passages are going to be able to absorb the spray, and it may change over time. And there's a number of ways to improve that absorption. Some people will use a neti pot. Others will use like a MAD 100 nasal insufflator, kind of like a nose spray type device to basically increase absorption across the nasal spray membranes. But it's really important to have good technique when you use the home-based nasal spray. Generally, some people will tip their head forward, kind of spray it towards the septum of the nose. That's the center part where all the blood vessels are located. Now, the issue with that is a lot of times the nasal spray will kind of go down the back of your throat and you'll get that bad taste. But of course, you are still going to absorb that ketamine that goes down the back of your throat. On the other hand, though, it won't be absorbed as effectively or as much as it does when it goes up into the nasal passages itself. Now, S-ketamine and at-home ketamine are two different therapies. S-ketamine is the FDA-approved version. In 2019, it was approved for unipolar depression. It's also got some approved effectiveness for suicidality as well. But S-ketamine is used only in the doctor's office. Insurance also may cover S-ketamine treatment in the doctor's office. Now, sometimes the doctor's visit might not be covered, but the S-ketamine itself may be covered. But the problem with S-ketamine is that its out-of-pocket cost is like $1,000 per dosing. And the dosing is fixed at 56 milligrams or 84 milligrams twice a week for 4 weeks, and then weekly thereafter. Now, the thing is that you're going to spray that entire dose into your nose, and the device is very effective at spraying that dose. So it's a very efficient device in getting the ketamine up into the nostril area there. And that may, in part, play a higher result with S-ketamine. However, the only thing is that S-ketamine can't be taken home. It's only done in the doctor's office. You got to sit there for 2 hours. and you can't drive for 24 hours afterwards. And that's just simply because the FDA put restrictions on that. Whereas the home-based nasal spray ketamine doesn't have the same FDA restrictions. It's technically used off-label, meaning that it hasn't been FDA approved, even though ketamine is FDA approved as an anesthetic agent. When you're using it in other manners, it's considered to be off-label, kind of like, aspirin being used for heart attacks as being off-label. Now, at-home ketamine can certainly be titrated over a broad range of effects. You can get basically as efficient a response with at-home ketamine therapies as you could with Spravato effectively by just increasing the home dose. Now, remember that racemic ketamine or at-home nasal spray ketamine is 50% S-ketamine and 50% R-ketamine. So if you increase the number of sprays, you could be administering the exact same number of milligrams of S-ketamine as the FDA-approved version. So what are the experiences with ketamine? And we're not going to delve too deeply into this, but the experiences don't always correlate with outcomes. You don't have to dissociate to get any effect. So there are definitely meta-analysis demonstrating that there's no association of antidepressant response to ketamine with dissociation. But some people will notice a certain amount of change in perception of certain colors and sounds and shapes, a change in cognition, emotions, maybe some out-of-body experiences at higher doses of at-home ketamine. But with the initial doses of at-home ketamine, especially if you titrate it up slowly, you may just notice some muscle relaxation, mood enhancement, a little bit of pain relief, and some general just feelings of happiness. But as the doses are titrated up, some people can certainly get a more enhanced experience. And just some key points about ketamine therapy is ketamine therapy is very safe in the treatment of mood disorders. Very high doses of ketamine are used in anesthetic purposes, and they're used extremely well and extremely safely in terms of the cardiovascular stability that's provided. Ketamine as an IV formulation is generally provided over 6 infusions over 2 to 3 weeks initially. Each infusion lasts about 40 to 50 minutes, and the doses can be escalated with each treatment, usually between the range of 0.5 milligrams per kilogram all the way up to 1 to 1.2 milligrams per kilogram over that period of time. Now, ketamine therapy outcomes are best when psychotherapy is performed during and after a session, and generally it's just after the session, which is integration therapies. In-session ketamine assisted psychotherapy can certainly be done as well, but many people find that they just want to have an inward experience. And the good thing about these ketamine treatments is that individuals can remain functional the following day for work. So you can get your treatment and still go to work the following day. Many people at our center will come into the office for their treatments later in the day, having worked all day, and then they go back to work the following day. And frequently, low-dose oral and intranasal ketamine can be used safely at home for maintenance of the effectiveness of the IV ketamine, as well as for lubricating psychotherapy. So a lot of times, individuals will use their nasal spray or their oral ketamine just shortly before they actually enter their psychotherapy sessions. It's just a way of kind of breaking down barriers and increasing cognitive flexibility. And as far as intravenous ketamine, over 70% of treatment-resistant depression patients have some improvement or remission, whereas many other therapies have failed. Now, the process to start home ketamine therapy with oral nasal spray has been discussed in some of our other videos, but basically if you suffer from depression, anxiety, OCD, PTSD, bipolar depression, chronic pain, headache disorders, chronic suicidality, postpartum depression, certainly you can be a candidate for this treatment. And your degree or timing of your mood disorder, even if it's recent, is certainly treatable with ketamine therapies. So generally an individual who reaches out to us will get a brief phone consultation just to make certain there aren't any exclusions to moving forward with treatment. And we discuss the options of IV infusions versus the home-based or at-home therapies. And we do require an in-office visit if you're looking for just the nasal spray or oral ketamine to basically take a look and see what's going on with your mental health journey. We have you understand the risks and benefits of this type of treatment, and that it works for a large percentage of people, but that it certainly is a treatment, not a cure, and that you will also be required to be an active part of your treatment process, meaning changes in lifestyle and integrative type treatments, exercise, diet, and a number of other factors to improve the outcomes of this treatment and also prolong them. And then we certainly can follow up by telehealth type appointments or in-office appointments. Some individuals will just use a combination of oral and nasal spray, ketamine in between IV booster infusions. But the one thing is that if you have certain medical conditions such as active addiction disorders, kidney failure, liver failure, uncontrolled diabetes, hypertension, active heart disease, or stroke, and a couple of other conditions, including schizophrenia or pregnancy, then we would definitely need to have medical clearance. And that would be one of the issues that certainly might prevent somebody from getting immediate ketamine therapies.